Mrs. Salvatore is 78 years old, was born in Italy and migrated to Australia in the 1960s. She has a supportive husband, Antonio, a daughter, Angela, and her grandchildren. Until 3 years ago, her memory started deteriorating. She would leave the gas on at home and was found wandering in her neighborhood. Being Italian, she has always been a carer for her family, cooking for them, organizing the household. She is the rock of the family. Family is very important in the Italian culture. She was admitted into residential care for people with dementia. She has mild to moderate dementia and has been diagnosed with Alzheimer's disease. She has balance issues. In the care facility, she tripped and fractured her distal radius and was told not to put weight on her left arm for 6 weeks. Older adults tend to have weaker muscles, issues with balance and gait, sensory issues, and confusion, which can increase their risk for falling. Some OPIs are, I want to be able to cook for my family, and I want to be able to feed myself. Dementia is an umbrella term used to describe a collection of symptoms that are caused by disorders affecting the brain. It is an acquired syndrome that results from a disease or disorder of the brain that affects cognition, thinking, and memory. It is a progressive disease that will gradually decline an individual's ability to carry out everyday activities. It has 3 stages: early, middle, and late final. You may be wondering why consent is so important. Informed consent is a person's voluntary decision about healthcare that is made with knowledge and understanding of the benefits and risks involved. In some cases, like Mrs. Salvatore, she has limited competence or capacity to make independent decisions about her healthcare. So, substitute decision makers are legally appointed. That could be her spouse or her children. Good practice in informed consent is as followed. Information must be passed on to the client in a way that they understand before asking for consent. Documenting the consent, so obtaining the consent in writing, and even if the capacity is impaired, an occupational therapist can attempt to obtain consent of the patient as far as practically possible, and then using the legally appointed individual. Occupational therapists are client-centered. They encourage patients to take interest and responsibility with their health. They use a collaborative approach and allow for shared decision-making in healthcare. The patient has to feel comfortable with an OT. Communication and building rapport is crucial. They also need to obtain informed consent for the care that they provide to their patients. The Berg balance scale is a 14-item objective measure that is designed to assess static balance and fall risk in an older adult population in a clinical setting, like a residential care facility. Static and dynamic activities of varying difficulty are performed. The occupational therapist needs a ruler to indicate 2, 5, and 10 inches, 2 standard chairs, 1 with armrests, 1 without, a footstool or step, if needed, for number 12, a stopwatch or wristwatch, and a 15-foot walkway. The test can be administered in a large room, and it will take 15 to 20 minutes.
Hi, Ms. Salvatore. I'm Melissa, your OT. Nice to meet you.
Nice to meet you.
So today we'll be using the Berg balance scale. So it's a test we use to measure your risk for falling. There are 14 activities we will be doing today to test this. I will read out the instructions for you for each activity. You will be scored from 0 to 4. And if you're able, I would like you to demonstrate each of them for me. Okay, so let's do number 2. So I'd like you to stand for 2 minutes without holding on to anything for support. Give me a moment. Do let me know, though, if you do need any help or support, okay? Okay, so I'd like you to start now. Okay, excellent, thank you. How are you feeling?
It's okay. Yeah, it's just
It looks like you're doing okay. How's walking at home doing for you?
okay. walking home.
Yeah.
Yeah, it's okay, but sometimes I'm very slow because I feel like I don't have that strength, and then like sometimes it's a little bit painful.
Yeah, definitely. We can work on that then for you. Yeah. Okay, thank you. So that's been 2 minutes. Do you need any help taking a seat again, or are you okay?
I think I'm okay.
Okay. So, after each of the activities, you have scored a 43 out of 56. So that's between the range of 41 to 56, meaning you're quite independent. But I will be keeping an eye, because of what you have been telling me and reading your history, that you do still have some risk for falling. And according to the norms, in your age range, the average is 51. So 43, you're basically, you're getting there, but I will be keeping an eye. Okay? Thank you for that.
Thank you.
Each item is scored on paper, and each item is scored using a 5-point ordinal scale, from 0 to 4. 0 indicates the lowest level of function, and 4 the highest level of function. When scoring, record the lowest response category that applies for each item. 41 to 56 means they are independent, 21 to 40 equals walking with assistance, and 0 to 20 means they are wheelchair bound. The lower the score, the patient is more susceptible to falling. A score less than 45 indicates that an individual may be at a greater risk of falling. A difference in 8 points was considered a significant change, but recently a change of 4 points is needed to be 95% confident that true change has occurred. This is if a patient scores within 45 to 56 initially. If they score within 35 to 44, 5 points, 25 to 34, 7 points, and 0 to 24, 5 points. Lusardi, Palecchia, and Schulman in 2003 found these scoring norms for each age group using the Berg balance scale. The ICF checklist is used to elicit and record information on the functioning and disability of an individual. In Part 1, written records, impairments of body functions are written down for the patient. The Berg balance scale will be used to fill out B235 vestibular, which includes balance functions. The Berg balance scale is a standardized assessment tool. This instrument addresses the individual's ability to maintain an upright posture, make adjustments for voluntary movements, and is used to screen for balance problems. It is a reliable and valid measure that can be used in ages 18 to 64 and 64 plus. It is widely used to assess balance with older adults who have suffered a stroke, have Parkinson's disease, and older adults in residential care. It has scored excellent in test-retest reliability, inter-rater and intra-rater reliability, and internal consistency. The translated version of the test had also scored high in each psychometric property.